Isolation and quarantine is one of the tools in the public health toolkit. It has been employed for well over a century, and it's proven effective in sort of preventing transmission for outbreaks. Some people have reached out to us and said the CDC guidance states that quarantine can be reduced to about 10 days, and with testing even less. Currently, the New York State guidance is that quarantine is for a 14-day period. I will tell you that the CDC guidance is taking into account that if you shorten the 14-day period to 10, that there may be greater compliance and that people are more likely to go through quarantine. The signs still support the fact that, again, people can be symptomatic until about day 14. But if it was reduced to day 10, you would capture the vast majority of people who would become symptomatic. But nonetheless, we're waiting for New York State to adjust or to come in line with the CDC guidance. So as of now, we are following New York State guidance, which is quarantine is a 14-day period. When individuals are placed on quarantine, that's with the understanding that they've been exposed to a case of COVID, and that within the quarantine period, they may be incubating and subsequently develop signs or symptoms of COVID. So the question comes up, if I test negative, can I come out of quarantine? And the answer to that is a resounding no. Mainly because when you test, you're actually looking at one point in time. And so if you test on day 3 and you're negative, that does not mean that on day 5 you will not become symptomatic or test positive, or on day 7 or on day 10. And so when individuals are on quarantine and they test negative, it gives people a false sense of security. So quarantines are for people who are exposed, and they should stay through the confinement period until it's over. Hopefully they remain asymptomatic. If they become symptomatic, then obviously there needs to be a discussion with the doctor about testing and confirming that indeed you became a case. One of the last things I want to remind people is that isolation quarantine is critical, and that people employ them on a timely basis. So individuals who are symptomatic and test positive for COVID, they should isolate themselves for a period of 10 days. It's also important that they identify and contact people that they may have exposed, and they should inform them that, again, that they were in contact with someone with COVID, and they should quarantine. If you are one of those individuals who was exposed, you should quarantine for a period of 14 days. And it's important you do that right away, and even before the state or the Dutchess County Department of Behavioral Community Health has had an opportunity to reach out to you. Timeliness is critical so that the transmission cycle is blocked. And this is one of the things that we could do that could really impact the curve and transmission in our community.